And welcome to the December session of the Formfast Educational Webinar Series. My name is Aaron Vaught. I'm the Director of Marketing at Formfast, and I'll be your host today. This session in the series for the year, and we're ending 2012 with a very important topic, namely maximize revenue in your hospital. Hospitals are trying to do more with less, and it's important to hold on to every bit of revenue possible. So today, Cliff Babbitt will be joining us to talk about some simple ways to protect revenue that you've collected. But before, we'd like to learn a little bit about how you're managing your business processes. We'll be posting a couple of questions on your screen. Let us know how your hospital currently operates. Those are coming up now. Doing that, I'd like to take a moment to review a few items. First, if you missed any of our previous sessions in the series, you can review all of our previous webinars on our website at formfast.com/webcasts. We featured a panel of healthcare thought leaders discussing what Obama's election will likely mean for healthcare providers in the future. A lot of great conversation there, a lot of good insights. Definitely take a moment to check that out. And once again, you can view that at formfast.com/webcasts. The broadcast session will be broadcast through your computer speakers. If you're having trouble hearing the audio, send a chat or a question to me, the host, and we'll make sure to allow you to join the teleconference. With the teleconference, please mute speakers, otherwise you might hear an echo. Questions at any time during today's session in the Q&A section on the right-hand side of your screen or that window. Questions will be reserved to the end of the session, but we'll collect those throughout the entire presentation. And I want to tell you a little bit about who Formfast is, in case you're new to Formfast. We provide automation solutions for healthcare. Since 1992, we've been dedicated to helping hospitals become faster, smarter, and working at a lower cost. We do different types of technologies. Electronic forms management, or eForms, is one of the type of technologies we're most known for. We're the #1 eForms vendor in healthcare, so we're very proud of that. Also, we're known for workflow automation, routing workflows throughout your enterprise to streamline communication and encourage collaboration, done through our FastFlow workflow system. FastFlow is business intelligence tools that are built in, including dashboards and reports that insights into your business processes, allowing you to identify where issues with patient safety or revenue loss lie. To provide electronic document storage as well as output management solutions. We'd like to discuss how we could help you in particular. We know each hospital is different, you have different needs, so we'd love to have a conversation about the best ways that we could help you. A couple ways we can do that. At the conclusion of today's session, there will be a screen that pops up that will allow you to click on a button to schedule a free consultation with a form specialist. You can also request information there, as well as requesting or registering rather for our next webinar in the series. And we'll be at HIMSS. Here to stop by booth 5541, which is our booth, to see Formfast demos, meet other Formfast customers, and take advantage of giveaways and prizes that we'll be doing. I'd like to introduce our speaker for today. Cliff Babbitt is a solution architect here at Formfast. He works with customers to help them discover room for improvement and develop solutions to address those challenges. As I mentioned, Cliff will be discussing some of the ways that workflow can assist in protecting revenue. So Cliff, at this time, the floor is yours. I'm going to pass you the ball here.
Thanks, everyone, for joining. Good morning to those of you central time zones and west, and good afternoon to those of you who've in the eastern zone. So, Aaron mentioned the focus today will be to cover some ways that Formfast has has joined our customers in uncovering and automating the business office and areas in patient financial services. So the first, I'd like to just briefly talk about a few of those areas, and we'll dive into one in particular. Initially, we'll spend the lion's share of the time talking about automation options for billing exceptions, how rejections and denials that come back from claims submitted to insurance carriers can be processed and improved in the FastFlow workflow automation routine. And then there are some other areas where we've our customers and looking at automation routines for making sure that information is in a timely fashion to those people who need it. For example, coding queries, frequently questions about those where a diagnosis or procedure code may be complete or missing some information, and they need to validate that with a clinician. We'll talk a little bit about the workflow automation routines available with FastFlow, and also some implications of the upcoming ICD-10 changes. So, potential area improvement in capture, taking what might be a manual process today of filling out a charge form and submitting that to the business. Now that can be automated and put online through FastFlow. Customers who are using audit management tools to keep track of rack and make processes, and make sure responses are done in a timely fashion, and that no timelines are missed. And all of this there is really ensuring policy and procedure maintenance. Also, charger maintenance is another area where internal collaboration is key, and having information passed to a committee that manages changes to a charge master, automated with a tool to ensure that everyone sees and understands the implications of those changes to the charge master. First is an opportunity we had with a customer. I'll talk specifically about one situation where a customer had need for automation in managing their denials and rejections. In their status quo, the customer would receive a rejection or denial message back from their insurance carrier for the particular account, and that user may send that rejection by email. So it's an electronic process, but it sends email to a billing specialist who maybe understands about the potential process and who needs to be asked about more detailed questions. So this might be a government payer specialist who can submit that question. Sometimes that user may understand enough to answer the question immediately and send it back to the biller. But frequently, we'll need to generate a message through email that gets sent to in a document. It might be one or many people that need to answer a question about a missing or incomplete or incorrect code on that particular account. So that user now has a message in his or her inbox, and the information here was with them. They had enough users in the hospital that have, as all of you know, many responsibilities to work, and relying on that user to proactively manage the multiple requests and questions that come in can sometimes lead to delays, and responses never made it back. So that respond immediately, or he may if that sits in his inbox for 3 days, for 10 days, that means an account that may worth thousands of dollars to the hospital goes unbilled. And lying in the status quo for having one of these individuals continuously manage what needs to be done in that process, checking their email, making sure that they responded to all of those in a timely fashion. So these have led to long times or cases that just didn't get rid to in weeks, potentially leading to significant amounts of unrecognized revenue. What we did was look at the overall process and incorporate that into FastFlow, where now it's still a similar process of the creates a ticket that's sent to the billing specialist to identify some missing information and then passes that on to the departmental user. But now those controls are in a software that's keeping track of that and providing exposure to management to ensure that things don't get left unanswered, and that there's accountability now and reminders for those who do have multiple responsibilities and don't have the bandwidth to be able to manage those, at a low level. So that begins with the form itself, and that's where the power of FastFlow really takes hold. In the existing process, they used an email and would attach a screenshot from their billing software. In this example, it was SI, and that would be sent to the user, and they may have some information that they need, but may have out to their HIS to look for additional information. Now we can pass a lot of that data on the form itself because it's secure, it's in FastFlow, and we can pull their HIS information right onto the form. And the initiator here would have some information that's required on the left-hand side of the form. All of the required fields are surrounded in red, quickly visually indicating what needs to be filled out and what doesn't. So the filler that initiates the request here in this particular form, whether it's a rejection or a denial, may submit that to the billing specialist after querying an account number to pre-fill in the information about the patient's last name, first name, the service location, payer, and really a lot of key data rather than having that keyed in or add in potential for mistakes. So all this is native information that's being pulled from their guests. What we're also doing on the form is automatically filling out today's date and calculating a due date from that, and calculating that on the form. So as you see in the due date field, both in the bottom right-hand area of this form and under the charging response in the top right, we have a due date of 12/16. And this, and if you see that the organization wanted to enforce around a 3 or 72-hour turnaround time, that would become immediately visible to anybody seeing that. It would put them in the form itself and give them reporting tools to be able to manage that, so that if days came and they didn't have a response, they had the tool to go back and understand why it wasn't answered and make it happen in a timely fashion. And then there's also an area on the form, obviously, where we're what exactly needs to be answered. In an email, rather than having free text where they have to specify it every time, this now becomes a drop-down list of charge codes, diagnosis codes, and HCPCS codes that can be specified for that user. So it's right at their fingertips, and then it gets sent to the department users, who will then fill out, is there a modifier. They can select from a drop-down list or key that into the field if it's not one of the common ones. And then they can review those codes, deliver information if chart dictation is required for medical necessity, specify a delivery method, and then add any notes onto that form. Now, data is not available to the users that are involved in that request, the billing list and the departmental user who is going to answer the question, but it's also available to management who can review dashboards and reports and go into what's going on in the organization. I cut out some of the patient information for this particular example, but there are all the fields now on that form, as well as some workflow information available for us to enter into that from a management perspective. So I can see all the workflows that are outstanding, how long they've been out there in someone's inbox, and could potentially see exactly what the denial or rejection is on the form, and to drill down into more detailed information. So this provides accountability and access to all of that information to those who need it when they need it. This real-time data on the dashboard here, but we also have options to generate reports on a schedule to specific users. So if every day morning I want to see a report of rejections that have been outstanding for more than 5 days, that's something that allows me now to go in and see where the problem areas are, what the reasons for common reasons for rejections and denials, so I can go back and potentially improve the process going forward. So related workflow similar to this is something that we've done and integrated with our partners in a process for coding queries, submitting questions from the coder to a physician. And in this, in most of our experience doing this, the coders have a bucket of forms that they may frequently access for comments about problem diagnoses or procedures, and those would be represented in forms like heart failure, pneumonia. All of these forms now have specific information that may need to be validated or filled in by a physician to make sure that we capture proper information or submit that carrier at the beginning. Again, closing the loop on that information process and the collaboration inside the organization. So the physician or physician receives that query form, responds inside the form, electronically signs it, and then it becomes part of doc management system and can be reviewed by anyone that has authentication through medical records or HIM. That process now, again, just as the denial and management workflow, gives us actionable information. We can review how many forms of a particular type have been submitted and really have an understanding now of where our problems are. We can see, in this example, pneumonia queries, number all of the other queries, and maybe an area for us to improve in clinical documentation. We may need to go back and understand what it is that we're missing when clinicians are documenting. It may not be something that they understand is a problem for revenue for the hospital. So if we can have that conversation, have the tools to improve that process, we'll be much better off. So what does ICD-10 apply for us in October here? Those who have been involved in that process are painfully aware of the upcoming changes. And for those of you who aren't, ICD-10 is a diagnostic classification scheme that will be much more specific than the current version. The current version, ICD-9, has anywhere from 3 to 5 digits for the codes, and the first digit can be an alpha character, which means they're going to be about 13,000 codes. There's a little bit less specificity in some cases than carriers would like, than more specificity that exists in the chart but doesn't necessarily get passed on in that code. For example, there's no locality or left or right designation in the codes in ICD-9. Once we move to ICD-10, there will be up to 7 digits in that code. Up to 5 of those can be alpha characters, which means there's a lot more room for specificity. Out of the gate, there will be about 68,000 codes, and there will be room for more specificity or more codes moving forward. So it really will be a more flexible system, but has that mean that users are going to need to understand that scheme, be able to provide that specificity, and ask those questions of the clinicians. That higher specificity, the liability involved in that, may mean that existing documentation methods aren't sufficient for capturing the diagnosis code exactly as they'll need to be done once ICD-10 rolls out. The need for that collaboration and communication inside the organization is going to be more important than ever, and we're seeing an increased interest in improving the reporting capabilities that you have in place today, so that when that transition takes place, a lot of information is available at your fingertips and can help you improve the process and have a smoother transition. It was a topic, in the past couple of years is the audit management process, and some organizations have had demand for audits than others, or have been audited more frequently than others. So it is being varying of importance to different organizations based on case mix and other sorts of things, but the process can be very complex. We've had more include process to automate that inside of FastFlow, which really has, I don't know if you can see some of the detail on the screen, but it captures some information about that transaction to kick off a process. We can scan information that needs to be passed on to those auditors and trigger to start where we can keep of when those steps need to be performed. Adding the 45 days to respond to that, and an additional calendar days. The balance is to be able to request extensions and send reminders to users in the process to make sure that we get the information back to the coordinator in a timely fashion. So all of this now can be built into a process that's being managed online through a FastFlow routine that adheres to existing RAC processes. MIC audits are very similar to this, and can be really designed around the scenarios that are specific to the Medicaid contract audits. But all of this now can be automated in a way that adheres to organizational policies and procedures and provides more information to the management users and those involved in the processes. So what's helpful, we wanted to leave a little bit of time for additional questions or comments about areas where you may be interested in improving office or patient financial services automation. Thanks for your time.
Great. As to questions at this time, and we do have a question that came in during the presentation. Ken wants to know, in regards to queries, do they automatically go to the electronic medical record?
The thing about workflows in Flow is that we already have metadata captured about the account number, medical record number, that is key to indexing that in the medical record, and we have routines with many other vendors to send those files at the end of a process directly into the EMR or the document imaging system. Great question.
In regards to the poll that we did in the beginning, there did seem to be a good portion of those polled that indicated that magnet revenue was a high priority. Is that congruent with a lot of the customers that you're working with? Is that a trend that you see?
Yeah, I think we're into where many organizations have spent a lot of time and effort improving processes and adhering to the regulations that in those areas, but CS and PFS stores of the demands to make sure that revenue stays stays constant or improving. And now we're getting to a realm where there's has already taken in a number of other areas, and we're looking for additional places where we can improve throughput and visibility.
That just came in. Is the only ticket can be opened is by manual process, or can it come directly from the 835?
That's a great question. It's actually an area where we haven't automated for this particular process, but it is a possibility that we're investigating. And this is the kind of thing that we love to have that in with our customers, because we tools, if you will, to do these things. With fast print, there are tools capturing data and done out in a number of different ways, and we are looking at that, and that's an excellent way to think about automating that process. Today is done manually in this example, where they get the response back in their billing software. That ANSI message comes into their billing software, and they separately and manually put that into Formfast. But that's a logical extension there. Very good thought.
Several different applications there that with RETs and claims rejection, a few others. Is there one in particular that you would recommend that our listeners start with, a process that really jumps out as low-hanging fruit in terms of protecting revenue?
Depending on existing processes, I would say it varies from one location to another, and what systems you have in place today. My experience personally is that some organizations have a very good process for things like coding queries, or case mix may be such that they don't have systemic problems around getting responses back in a certain time period. But I think coding queries, as I mentioned with the upcoming ICD-10 changes, personally that's an area where a number of organizations are looking to make sure there's not a decrease in revenue when that switches over to ICD-10, that there's not a hiccup with that additional information. But in MIC audits, I are for a number of organizations have some solution in place, and there's organizations, the risk for auditing is fairly low. For others, it's higher. We've experienced with some physician-owned hospitals that have high Medicare reimbursements, that bigger audits, unlike some other some organizations that those flags go up and they have more of a demand for that. But I really think code and query is an area of automation within FastFlow if there's not already something working well in an organization today.
Great. Advice you'd like to share with our listeners here as we await final questions?
So what we find frequently is that there's never one to improve a process, but that if we can sit down with our organizations and really understand their business needs better than anyone else, obviously, and it really of having that dialogue of what's important in the process, what needs to be, what information needs to be available to different involved with that, to management, and able to design that in a way that the way doesn't just pave an existing path or improve an existing path, but actually creates an entirely new path that brings a new perspective to that. So it's a little bit cliche, but I really believe there needs to be a new perspective sometimes on processes that you step back, think outside of the current kinds or outside of the box, if you will, that we do processes in a brand new light and understand exactly what it is that we need to, rather than how we can there a better solution based on what we've done in the past.
Right. Great segue into what I mentioned before. We want to speak with you and learn a little about your processes. As I mentioned, we understand that every hospital is different, so we want to consult with you and help you discover some ways that we can improve processes with our solution. Like I said, at the conclusion of the session, you'll be with the screen, so you can, by clicking on a button, you get to meet with the Formfast list, maybe even Cliff. And that is all the questions we have for today. So I want to thank Cliff Babbitt for taking the time to be with us, as well as the rest of you. We know that you're very busy, especially here at the end of the year. So we appreciate you taking the time. This is the last session in our educational webinar series of the year. However, you can register for the next session, which is tentatively scheduled for February 21st. We'll be a brand new product that you're going to be excited to hear about, so don't miss that. And once again, you'll get a chance to register for that at the conclusion of this webinar. Also, keep an eye out for invitations to other Formfast events. We have a lot of exciting events coming up in the next few months, so stay tuned there. Finally, take a moment and explore our website. We've recently added several new videos, blog posts, and other features that will help you discover how Formfast can help your hospital work faster, smarter, and cheaper. Have a holiday, and we'll see you next year.